Welcome to the deep dive.
Great to be here.
Today we're jumping into, well, a really specific but important part of healthcare, the global shoulder replacement market.
Mm,
We've got our hands on a recent market research report. It's called the Global Shoulder Replacement Market Report 2025.
right.
And our mission today really is to break down what this report says. How big is this market? Where is it going? What's driving it?
Exactly. We'll try and distill the key insights for you, cut through the noise.
Perfect. And just to kick things off, get this. The report estimates the global shoulder replacement market will hit USD 472.54 million in 2025.
Quite a number to start with.
Definitely. Okay, so let's dig in. That's the 2025 figure. What's the bigger picture, the journey ahead?
Well, that USD 472.54 million for 2025 is our baseline. But the really interesting part is the forecast. It's projected to climb significantly.
How significant?
We're talking USD 914.27 million by 2033.
Wow. Okay, that's nearly double in, 8 years?
Pretty much. It points to some serious momentum.
So what does that translate to in terms of, annual growth?
The report calculates a compound annual growth rate, a CAGR, of 8.60% for the period 2025 to 2033.
8.60%.
Yeah, so think of it like this. Every year, on average, the market's expected to grow by over 8% on top of the previous year's value.
Got it. And this is based on, 2024 as the base year.
That's right. Using historical data from 2021 through 2024, estimating 2025, and then forecasting out to 2033.
An 8.60% CAGR is pretty robust. So what's pushing this growth? What are the main engines here?
There are a few key drivers, and they sort of feed into each other. First off, demographics.
The aging population, I assume.
Exactly. We've got more older people globally, and with age comes a higher chance of arthritis, osteoarthritis, rheumatoid arthritis, conditions that really degrade the shoulder joint.
Makes sense.
And it's not just more older people, but, people in their 60s, 70s are often more active than previous generations.
Mm-hmm.
They're less willing to just accept pain and limitation.
Right. They want to maintain their quality of life, stay independent, keep playing golf or whatever.
Precisely. So they're seeking solutions, and shoulder replacement is becoming a more common one.
Okay, aging and arthritis. What else?
Sports injuries are another big factor.
Yeah. Shoulder injuries seem pretty common in sports.
They are. Whether it's serious athletes or just, weekend warriors, shoulder problems can happen. And sometimes a replacement is the best way to get back to function.
Okay, so demographics, lifestyle, injuries. But technology must be playing a huge role, too.
Oh, absolutely. This is where things get really dynamic. The report highlights several tech advancements. Minimally invasive surgery is a big one.
Less cutting, smaller incisions.
Right. Specialized tools, less disruption to the muscles and tissues around the joint.
Which means?
Less pain, typically faster recovery. It just makes the whole prospect of surgery less daunting for patients.
Yeah, quicker recovery is always a plus. What other tech is moving the needle?
3D printing. It's really changing the game for implants.
How so?
It allows for creating custom implants, designed specifically for that patient's anatomy.
So not just off-the-shelf sizes.
Exactly. Think about it, a perfect, personalized fit. That should mean better mechanics. Maybe the implant lasts longer, too.
Like a bespoke suit for your shoulder joint.
Kinda, yeah. It's about optimizing performance and longevity.
That's pretty cool. What about the actual stuff the implants are made of? Any changes there?
Definitely. Continuous improvements in materials. You've got biocompatible metals, things like titanium, cobalt, chromium alloys chosen for strength.
Right.
And then advanced polymers, like polyethylene, often used for the bearing surfaces to reduce friction. They're always working on making these materials more durable, less likely to cause issues down the line.
Stronger, lasts longer, fits better. It all makes the surgery more effective. The report also mentioned something about reverse shoulder arthroplasty, growing use.
Yes, that's a really interesting trend, reverse shoulder replacement.
What's different about it?
Well, in a normal shoulder, you have a ball in the arm bone and a socket on the shoulder blade. A standard replacement mimics that.
Okay.
A reverse replacement switches that. The ball part goes on the shoulder blade, and the socket part goes on the arm bone.
Huh. Why would you do that?
It changes the mechanics. It turns out to be really effective for people with really bad rotator cuff tears, where the muscles are too damaged to power a standard replacement, or for certain complex fractures.
So it expands the options for people with more difficult problems.
Exactly. It's opened the door to effective treatment for a whole group of patients who didn't have great options before. It's not just replacing. Sometimes it's cleverly re-engineering.
Fascinating. Okay, let's step back and look at the map. Where's all this happening? Geographically, who leads the market?
Right now, based on the 2025 data, North America is the biggest player.
How big?
Over 40% of the global market. That's about USD 174.84 million.
Okay. And growing steadily.
Yeah, the CAGR projected for North America is 7.1% through 2033. The U.S. market is the lion's share of that, obviously around USD 138 million, growing at 6.9%. Canada and Mexico contribute too.
And why is North America so dominant?
It's a mix of things we've touched on. The aging population, high rates of arthritis and sports injuries, plus early adoption of new tech, strong healthcare systems, and importantly, established insurance reimbursement.
Makes sense. What about Europe?
Europe's number 2, holds over 30% of the market share.
So still very significant.
Definitely. Around USD 137 million in 2025 and growing slightly faster than North America, actually projected CAGR of 7.6%. Countries like the UK and Germany are key markets there.
Okay. North America, Europe. Where next? Asia Pacific.
Yes, APAC. Currently about 23% market share, so roughly USD 113 million for 2025.
But I feel like there's a but coming.
You guessed it. APAC is where the fastest growth is expected. The projected CAGR is a striking 11.4%.
Wow, 11.4%. That's considerably higher. What's driving that surge in Asia Pacific?
Again, multiple factors. Rapidly aging populations in many countries there, rising arthritis rates perhaps linked to changing lifestyles, improving healthcare infrastructure.
Medical tourism maybe plays a role too.
Yes, that's mentioned. Plus just general economic growth and better healthcare access in huge markets like China and India. China's market is pegged at over USD 47 million, growing at nearly 11%. India, though smaller now, is projected at over a 13% CAGR.
So China and India are major growth engines. Japan and South Korea mentioned too.
Yep, Japan and South Korea are also significant contributors in APAC, with strong growth rates projected as well, around 10% CAGR each.
So the established markets are big, but APAC is really the one to watch for future expansion. What about the other regions? South America?
South America comes in at just over 5% share, about USD 18 million, but with a solid 9.3% CAGR. Brazil and Argentina are the main players there.
Okay. Middle East and Africa?
Middle East is smaller, around 2%, maybe USD 19 million, but growing fast to nearly 10% CAGR. Saudi Arabia and the UAE are highlighted. Africa is currently the smallest regional market, about 1%, around USD 10 million, but still growing respectably at almost 9% CAGR, with South Africa being the key market.
So growth seems pretty widespread, even if the starting points are different. Okay, let's shift gears slightly. The report breaks things down by type of procedure, right?
It does, and as you might expect, total shoulder replacement is the dominant type.
The full replacement.
Right. Driven by all that osteoarthritis, rheumatoid arthritis, severe injuries we talked about, it's the most common solution.
But that reverse shoulder replacement we discussed?
That's pegged as the fastest growing segment. Its success with those complex cases, the rotator cuff tears and tricky fractures, means it's being adopted more and more.
Are there other types mentioned?
Yes, briefly. Things like partial shoulder replacement, just replacing part of the joint, shoulder resurfacing, which aims to preserve more bone, and revision surgery, that's when a previous implant needs replacing.
Okay, so different tools for different jobs, essentially. Now, where are these surgeries happening? The end users.
Hospitals are the biggest segment. Makes sense, right? These are major surgeries.
Usually needing an inpatient stay, yeah.
But, interestingly, the report points to ambulatory surgical centers, ASCs, as a rapidly expanding area.
Outpatient centers.
Yeah.
For shoulder replacement.
Yeah, for certain patients and procedures, ASCs can be really efficient, sometimes more cost-effective. As techniques improve, especially minimally invasive ones, more selected cases are moving to that outpatient setting.
Faster recovery, potentially lower cost. I can see the appeal. Orthopedic clinics are mentioned too.
Right, they're involved in the whole pathway diagnosis, follow-up care, etc.
Okay, so the market's growing fast, tech is advancing, but are there any roadblocks? Things holding back even faster growth?
Yes, the report flags a couple of key restraints. Cost is a big one.
The price tag for the surgery and the implant itself.
Exactly. It can be very expensive, and that's a major barrier, especially in developing countries or places without robust insurance coverage. It limits access for some people who could really benefit.
A crucial point. Anything else?
The availability of surgeons with the right expertise.
Ah, you need specialists.
Absolutely. These are complex procedures. A lack of highly trained orthopedic surgeons in certain areas could definitely limit how many replacements can actually be done, even if the demand is there.
Right, you need the skilled hands to actually perform the surgeries. Okay, looking forward then, what are the big trends shaping the future of this market?
Robotics and AI in surgery. That's a huge one.
How are they being used?
For things like improving precision during the operation, getting the implant placement just right, helping with preoperative planning using patient scans, and enabling more minimally invasive approaches, the potential for better outcomes is significant.
Robotics and AI seem to be popping up everywhere in medicine. What else?
Continued focus on the implants themselves, the material science side.
Making them even better.
Yes, stronger, more durable, more biocompatible metals and polymers. And that ties back into the 3D printing trend, too. Creating those custom patient-specific implants is a growing area of interest.
Constant innovation on both the tools and the parts. So, who are the companies driving all this? The big players?
It's a competitive field. The report lists several major names. You'll probably recognize some.
Yeah.
Johnson & Johnson through their Deploy-Synthes division.
Okay.
Stryker, Zimmer Biomet, Smith plus Nephew.
The big ortho companies.
Right. Also DJL, Arthrex, Zactec, Conformis, which focuses on custom implants, Microport Orthopedics, Corinne. Quite a few players jostling for position.
And what's their main focus? How do they compete?
And generally, it's about technological innovation, new implants,
Wow.
better surgical systems, also strategic partnerships, acquisitions, and definitely expanding their reach globally, especially into those faster-growing markets like APAC.
Any specific examples of recent activity?
The report mentions a couple, like Smith plus Nephew presenting data back in 2021, Duploy-Synthes launching a new shoulder system called Enhance, also in 2021, and more recently, Stryker launching its 28 portfolio in India just this January 2024.
So lots of ongoing activity.
Definitely. It's a very active market.
Okay, this has been incredibly thorough. If we had to boil it down, what are the absolute key takeaways for someone listening?
I'd say, one, the global shoulder replacement market is growing strongly, set to nearly double by 2033. Two, this growth is powered by aging populations, arthritis, but also really exciting technological progress. Things like minimally invasive techniques, 3D printing, better materials. Three, while North America and Europe are the biggest markets now, Asia Pacific is growing the fastest. Four, total shoulder replacement is the main procedure, but reverse replacement is gaining ground fast. And five, we're seeing more procedures potentially moving to efficient outpatient settings like ASCs.
That sums it up nicely. It really is a fascinating intersection of demographics, lifestyle, and cutting-edge medtech.
It really is. And,
Yeah.
thinking about how fast things are moving, especially with materials and robotics, it makes you wonder, doesn't it? Well, how different could shoulder replacements look in another 10 years? How much better could the outcomes be? And crucially, could these advancements make the treatment more accessible, more affordable for people everywhere?
That's a great question. How will innovation impact not just the what, but the who gets access? Something to definitely keep an eye on.
Food for thought.
Absolutely. Well, thank you so much for breaking all that down for us today. Really appreciate the insights.
My pleasure.
And for everyone listening, thanks for joining us on the deep dive. We'll catch you next time.